today. It's like deja vu because I was doing this yesterday. So for those who've heard me once, you can go to sleep or turn away. I'll have to refer to my notes, I'm afraid. As the chair just said, my name's Alex. The reason I know that because it's written down here. I was invited to attend for the CCG, and obviously thank you for inviting me along. I'll try not to be too definitive about dementia, because living with dementia and people who suffer from dementia will suffer in different ways. So there's no commonality across the range of experiences that people give you. I was diagnosed after a 2-year period. It took 2 years from an initial visit to the GP, through the memory assessment service, through the clinical examination, scans and memory assessment tests, and given a formal diagnosis of early onset Alzheimer's in 2011. It's quite a long journey. Initially I was diagnosed with a condition called mild cognitive impairment. For those who are aware, it can be a preload to full-blown dementia, not always commonality. Having received the diagnosis, obviously it left me extremely cold. I wasn't that concerned. It sounds a bit strange this, because I lost my wife to cancer 15 years ago, and I went through the cancer journey with her for 2 years. She was only 47, so I'd already gone through the trauma of quite a considerable, as a carer, trauma completely through a journey right through to her passing. And ironically, when I was diagnosed with Alzheimer's, I made an assumption, which was obviously incorrect, that the services with cancer care would be not that too dissimilar with dementia care. How wrong could I have been? I was diagnosed, obviously, formally, handed a prescription and waved goodbye. So I left the memory assessment unit with a prescription in my hand, no information, got into my car and drove home. Sat there for a few minutes and thought, right, okay, yeah, that's fine. And then I just went into what could only be described, I just had a suck for 10 months, because I was just unsure. I didn't know anything about dementia at all, not other than my perception of some little old lady, some little old man in a care home, maybe in their 80s or 90s. I think it used to be called senility at one time, but if there was of a certain age. So I was only 60 and I thought, something not quite gelling here. I've worked for Macmillan Cancer Support for the best part of 15 years, before and after my wife's death. So I was used to dealing with all the complications around patients' experience and carers' experience, and I was actually involved with a lot of their publications in terms of putting our perspective on publications rather than the experts writing publications. But at that stage, I still didn't know that much about dementia, other than how to spell it. I couldn't remember how to spell it, but I remember it. So for a whole year, I went round to everybody that was talked to me. Chief Executive of Lancashire Care Foundation, mental health nurses, went back to my GP, anybody that was either medically, clinically, or involved with dementia, I wanted to meet. And I built up a portfolio of knowledge to fully get to grips with what that actually meant. What was Alzheimer's? What was the prognosis? I know there was no cure, that was fairly obvious from early stages. When I got to the end of that journey, and I got all this information, I got all the data, and I thought, right, yeah, fine. I then turned my thoughts to the prescription I'd been handed, and I thought, what's this going to do for me? And I know there's no cure, so there was no denial for me saying, oh yes, this is a wonder drug, I'm going to drink this, go away and get cured. And I went back to the memory assessment service undercover one night and asked for some research papers on the 3 common drugs used for, not the word treatments of Alzheimer's, but to help, maybe help somebody with early stage Alzheimer's. I even got back to see the consultant psychiatrist and I said, can you just explain it in very, very plain English? If I take this drug, what's going to happen? And he explained it with a little graph, and I should have brought it in today because it's quite funny when you think about a medical clinician writing on the back of a piece of paper a graph about dementia, diagnosis, and going into late stage dementia. And the drug that was prescribed to me, the graph that he drew ended up at the same point. And I said, well, if I take the drug, I'm going to be here. If I don't take the drug, I'm going to be in the same place. And he said, yes. So a little bit bemused by this, I thought, can you run that back through me? So what's the point in taking the drug if I'm going to still arrive at the same place? And he said, inverted brackets, it'll become a little less foggy. Now, I don't know if anybody's got dictionaries, but what does a little less foggy mean? Dementia's a really lonely place, trust me. The very best of us may fail at times. Obviously we may sink into depression. We know what's to come. I'm a realist, I know exactly what's going to come. I don't want to visit it too often, but I do know in late stage dementia. I suppose the good thing about it, I probably won't know what's going on anyway. But it does have a ripple effect to family members, to friends, right across. We find ourselves frustrated and angry. It's not anger at having dementia, it's angry saying, what comes next? You give me the prescription, you give me the diagnosis. Is there a bell that rings somewhere along the line which says, this is the plan, this is what we're going to do? Because when my wife was diagnosed, the minute we came out of the consulting room, there was a breast care nurse there who mapped out exactly what was going to be done, what the clinicians interpret, what the clinicians had said in terms of the diagnosis and prognosis. And there was a period at which, right the way through the 2-year journey that she had, some certainty, not uncertainty in terms of the outcome, but certainty in terms of this would happen and this would happen and this would happen. Not for somebody with Alzheimer's or dementia. You go away. And it's interesting, I'm sorry to be a bit finicky, but you refer to me as a patient. I'm not a patient. I don't appear on anybody's books. Once I'm diagnosed and leave the memory assessment service, I don't exist. I have not been seen by anybody since diagnosis in 2011. Going through that period, I thought, well, there can't be just Alex Burton, there's got to be hundreds of people in Lancashire who just sat there sulking and saying the same thing. So I said, something needs to be done. So I formed a group called Lancashire Dementia Voices, which is a simple aim, was to bring our voice out into the public. I use the word out, I don't want any misconceptions about that, but I wasn't proud of having dementia, but I thought if we keep talking about it in closed doors and behind closed doors, we're never going to educate the public. Most of the public say, yeah, dementia, you know about, they don't know. So one of the remits of Lancashire Dementia Voices is to raise that awareness, but from our perspective, not what you've read in books and not what you've given in leaflets, but say, this is actually what it's like. So what's it like living with a condition? It doesn't hurt for a start. There's no pain involved with dementia. But how many people in this room have second-guessed, this happened to me just 2 hours ago, gone to a public toilet, and nowadays you get 2 symbols on the doors. You get the man and the women, but you don't have the word man or woman or ladies and gents, you have 2 symbols. And one of them seems to be wearing a skirt. So all ladies now wear skirts. So you double glance and you're still not quite sure, and you think, if I push that door open, am I going into the right place? And we've all done it, so nobody can deny it. You don't just automatically, just a quick second glance and say yes. That's only one element. I was asked yesterday about, can you put it to a more finite position? Right. My GP, when I first went to him, said, everybody loses the keys. I thought, all right, we're on this scenario. Fine, yeah. How many people around this room said, where's my car keys? Can't find my car keys. The difference being with somebody with dementia, I couldn't remember that I was actually going to look for my car keys in the first place. So that's gone. That doesn't exist anymore. So if I was looking for my car keys and I've left the room, I wouldn't even have any recourse to go back. Those are some examples. You could write lists and lists and lists of these. The fact that there's no post-diagnostic support for people like me across the whole of Lancashire is a disgrace, quite frankly a disgrace, because a lot of the people are relying on charities like the Alzheimer's Society, which obviously have advisors at memory assessment. Most of our members fell through the net, but they reside in the memory assessment service. They run dementia cafes for people maybe in the moderate who want to socialise. That's a social support. That's not what I'm after and what my members are after. And one of our prime concerns is, can we not be just seen once a year? Is that such a big ask after 1 year to say, right, bring you back in, and we'll go through the tests or whatever it happens to be to see how you're progressing. And people say, well, yeah, but your carers will notice that. Sorry, I don't have a carer. So where do I fit into that? Do I get up on a Friday morning and say, oh, I think things have changed because it's a different time? So I feel very, very vulnerable around that. Dementia Voices is not the same as Dementia Friends. I have some time for the Alzheimer's Society, and I don't, people probably picked up yesterday, they don't represent me, and they certainly don't represent the group that we have with patients and carers. Reason simple, the government's introduced, or the Alzheimer's introduced with support for the government, Dementia Friends. And I think anybody that's given up their time to volunteer for Dementia Friends needs a pat on the back, because it's worthwhile. But as you're all sat there looking at my forehead, unless I've forgotten to wash this morning, I actually rubbed off the word, I have dementia yet. You're not going to recognise us. We don't walk around in a funny format, or we look strange, or we smell strange. So Dementia Friends will only be active if that person who wants to give support knows that person's got a dementia condition. It's about communities, it's about people like yourselves in the commissioning units to ensure that whenever you commission services and people talk about patients and care involvement, it really is patient and care involvement. The engagement we had with the new unit at Blackpool, the new mental health unit, we were consulted on the cover of the carpets in the reception. That's not user engagement. User engagement is about saying, this is what we're planning to provide. Can we have your input there to make sure it's truly dementia or carer-led? And bear in mind that you'll get a different story from a patient, completely different from a carer. They'll come at it from completely two different angles. So final word, we're only a small group, we don't pretend to be, but we're a voice, we have a voice. I was diagnosed on a Tuesday. I was Alex Burton on Monday. Guess what I was on Tuesday? Alex Burton, but with a condition. There are some elements. We formed a partnership with the Lancashire, Greater Manchester, Lancashire, South, don't you like long words? Greater Manchester, Lancashire, South Cumbria Strategic Clinical Network, who wants to engage a group specifically around dementia to get an input of experience which you can't buy. We don't charge, well not quite charge, but we don't charge for our services. What we're trying to do is get you people to understand that when you develop and design or commission a service, a patient that's got another Alex Burton that's going to go in 2 years' time will have a much better experience as they go through that journey. And the other thing that I just wanted to finalise, why can't your computers talk to each other? The clinical psychologist sat there and handed a prescription. Now, I did some training around complementary therapy, and I was told about contraindicators before you write a prescription out. Had I not been observant, I have a heart condition. I went off to my cardiologist and said, I've been given this prescription. Oh, I'm really glad you told me about that, because that could have quite a serious condition on your already condition. So I got the two consultants to write to each other. Now, sorry, was I the patient or a simple thing like that to explain and to understand. Give it to us in English, allow our pathway. You all heard the news a couple of days ago, which is brilliant news about the potential drug for Alzheimer's. There's caveats in that, we all know that. We know the government are squeezing coffers, it's got to go through public scrutiny before it's out there. But I can't wait 3 years, I need the support ongoing. I don't need to be seen every week, I don't need to be seen every other day, I don't need to, but please keep tabs on me. Nobody is, and none of our members are. Just finally, before I sit down and get told to sit down, if you think, well, yeah, things have changed, Alex. Now, it's 2011. We got this email, very short email, through our website 2 weeks ago. I'll just read it to you. To me, it sums it all up. Hi, my husband has been diagnosed with vascular dementia in April of this year. He had a massive brain hemorrhage 2 years ago, last May, that has left him disabled, partially sighted, and with dementia. After his diagnosis, he has had no follow-up appointment or anything. I've just been left to deal with everything. It seems to be developing really quickly, but I wonder if this is normal or could there be something else. I've never had any contact with anybody regarding dementia and really feel we've been just left in a cupboard and being left to get on with things. And they were asking us for advice, a small group like ours. To me, that's not acceptable. In any condition, we're talking about patient-centred care. And this is not the only one. I can give you lots of names. It isn't perfect. We're not looking for perfection. As a patient, what we want to be is so you've diagnosed me. Don't just get rid of me just because you give me a diagnosis. Could you keep tabs on me? Or somebody keep tabs on me? So I don't know if anybody in their family's been affected by dementia. I'm just one voice, but we're growing. We're part of a network called DEEP. Now, a lot of people won't have heard about this. It's called the Dementia Engagement and Empowerment Project, which was set up 3 years ago, funded by the Joseph Rowntree Foundation, to support groups like ourselves right across the whole of the UK. When that started 3 years ago, there was about 5 or 6 groups. There are now nearly 60 groups throughout the whole of the UK, with a population of about 500 or 600. So if we start to open our voices, then we can be heard. And the Commissioner should use our group. We'd like to facilitate our group, because we don't have jobs to worry about, we don't have salaries to lose. I don't mind talking to MPs. I gave a presentation to Westminster 4 years ago to our health men there, and they were all sort of nodding, saying, yes, we know there's problems, Alex. And I don't want to hear the problems, where's the solutions? They're not that difficult to find. So thanks very much. I know I've overrun yet again.
Thanks, Alex.
Thanks very much for your time.
Thank you.
Okay.